and today's video we will learn about intravenous injection. First we have to select the place where we want to inoculate. Then we have to find a vein that is the most visible and start inoculating there slowly. When the needle of the syringe is to be inserted into the vein, the back part of the syringe is pulled outward and it is to be seen whether blood has come into the syringe or not. So understand that the vaccination did not take place. And when the blood gets into the vaccine, the vaccination should be started. So the injection should be done slowly. And at the same time, where the injection is being done, the vein should be moved upwards by hand, so that the flow is good. In the same way, full injection should be done. One thing to always remember is to inject very slowly so that the patient feels good. One of the advantages of slow injection is that the time of injection is fine, and the chances of reaction are reduced. And if the injection is done too fast, the chances of reaction increase, which can cause many problems. So every time the injection is done, it should be done slowly, so that the chances of reaction are minimal.